I am Doc Askins, the psychedelic science war storyteller, and this is the Anti-Hero's Journey podcast. What's up, all you anti-heroes out there? This is Doc Askins bringing you another Q5 podcast episode where I ask some pretty awesome people 5 awesome questions. They're 5 of my favorite questions that I use in preparation sessions for ketamine-assisted therapy. I've got Dr. Sofia Peeva on the podcast with me today. She is one of the pioneers and early adapters of using low-dose ketamine in combination with psychotherapy to treat treatment-resistant depression, anxiety, PTSD, and chronic pain. Her clinic, called Propel Therapeutics, is located in Sacramento, California. Sophia, how are you doing today?
I'm doing great. Thanks for the invite. It's been really nice to feel like somebody wants to hear, my opinions on all this.
Yeah, I'm really excited to hear everything. So let's jump right in. What's your story?
So my story is that I'm an anesthesiologist, and when I came out of my training, I was very energetic. I was ready to work. I went out there. I joined a private practice, and I basically burned out in 4 years. I was in a depressive state. I was irritable. I couldn't kind of stand my work anymore. Even though I loved what I did, I just couldn't keep going to work. Some days I'd be driving to work thinking, oh my gosh, is this what I'll be doing for the rest of my life? And it just felt like didn't feel right. And so so I quit my job without any backup. I just basically gave my resignation. And then I kind of went on a little internal journey for a few months to try to figure out how to make myself happy.
Wow, that's really gutsy.
I joined up forces with Dr. Fisher, who's a psychiatrist, and I was telling him that ketamine has been shown to have some good results with treatment-resistant depression, anxiety, PTSD, and I told him, hey, I feel very comfortable infusing this stuff. If you would like to do the psychiatric portion of it, because obviously, ketamine therapy has some requirements, I think, to make it more successful than not. And so then we joined forces and we opened up this little clinic. And it used to be just something we would do on the side. I would go to work all day, and then after work, I would go back to the clinic, and then we would do our thing for another 3 hours, give people ketamine therapy. And then eventually it grew into a clinic where we created an immersive environment. And now we help hundreds of people, and it's really rewarding, and it's really grown from this tiny little idea to a place where I have employees, and also a place where I'm kind of healing a lot of people and also taking good care of my employees. It's a really good spot that I enjoy. I feel very proud of it. So yeah, that's my story. It's mainly, I'm just on a quest to see how I can impact the most amount of lives.
Yeah, tell me a little bit about what attracted you to anesthesiology in the first place, if you're willing.
Sure. So I'm not sure what the first thing was that did it, but when I was a young girl, and I'm thinking 5 or 6 years old, what I remember I used to do is I used to have all of these dolls and stuffed toys at home. And one of my favorite activities that I would do to all these dolls is I would line them all up. And then my grandma would also be at the end of the line. And I would go around and give all of the toys a shot. I used to have these play doctor kits with a big syringe. So I would give them all injections. And then at the end, I'd get my grandma too. She was at the end of the line. So then for a long time, I used to think I want to be a doctor. I want to be a doctor. And then what kind of doctor am I going to be? I didn't know. At first, I thought I was going to do surgery. So at first I was going to do surgery. And then all of a sudden, I decided no, anesthesia is the way to go. And honestly, I feel like I made the right decision for myself. I really enjoy the work. I enjoy the interactions with the patients. I enjoy like the cerebral part of it where you're thinking through physiology and, different scenarios. So, yeah.
Did you grow up out in Sacramento? Are you a California native?
So not exactly. So I was born in Bulgaria, and in 1995, my parents got the first wave of green cards. That was Bill Clinton's administration did the green card, so they were one of the first waves out of Bulgaria. So we came in 1995, and we were in San Diego. So technically, I've lived in California for most of my life, but not Sacramento. Sacramento, I've been here for about 6 years, and I love it. But it's supposed to be a big secret. Don't tell everyone. It's not good here. Don't go.
Yeah,
But I love it.
it's not the spot. Not what everybody wants. Okay. Wow.
Yeah.
What did your parents do?
Oh, both of my parents are engineers.
Okay, problem solvers, right on. My dad was an engineer too.
Yeah.
Okay, so you grew up giving dolls shots and went into anesthesiology after, deciding surgery wasn't the option. I mean, you're still in surgery in anesthesiology, but you're the one that gets to relax and sit down and, monitor the patient rather than, I never enjoyed my surgical assistant rotation. It seemed like the only two cool jobs in the room were being the surgeon or being the anesthesiologist. Everybody else there is just kind of walking on eggshells trying to make sure this person doesn't die. But that's pretty cool. And then you got burned out and just jumped off the plane, like just grabbed a parachute and jumped out of the hospital. That's gutsy. Like, tell me, if you're willing, tell me a little more about the decision to just say, you know what, I'm out. I got to do something else with my life.
I think part of it was when I started having chest pain, like in the middle of the workday. Yeah, it was really weird because my whole life I've been really fit. I'm really competitive. I have done a ton of sports growing up. Being part of teams and national teams and everything. So to have chest pain, that was kind of like, oh come on, what is this stuff? And then eventually, what I did was I got an EKG, and the EKG was abnormal, and this I think was kind of like, oh my god, something is happening. Like perhaps I need to make a change. And I just didn't see any future in the group that I was working with. I didn't feel that they were in the right trajectory, and I just didn't want to get sucked in even more with them, and waste more time, if you will. So it was a decision like that, and I had a really supportive spouse, of course, who was, there and saying like, hey, look, financially, we're going to be okay. You can just stop and find something you're happy with. So I think that really helped. But I think even if that person wasn't there, I was still going to do it. I don't know. I'm just like that. If I don't like something, I will change it because that's the only way, right? I mean, grass is greener where you water it, not on the other side.
Yeah, this is the way. You just do what's right. And it's a big deal to have some support, but to also just know what's right for you and to go ahead and do it it's not something that everybody is able to arrive at. So that's really brave. I'm really impressed about that. What you mentioned kind of going on an interior journey there after deciding to grab a chute and jump out of the anesthesiology practice plane, and then that eventually landed you in doing this sub-anesthetic dosing of ketamine with your psychiatric partner there. Can you tell me a little more about that interior journey?
Well, it was just a reevaluation of what I value in life and what I think is important in the context of realizing that life is finite, it has an end. And so, you just have to do something that you are proud of and you're happy with because at the end of the day, life does end at one point. So even if you screwed up, it's all going to end at some point. So it's not a
Memento
decision
mori,
you're
they say, right?
Sorry, that was a little gloomy, but
No, that's okay. I think it's one of the 7 habits of highly effective people to begin with the end in mind, right? And they don't necessarily mean the end, like the heat death of the universe or the death of your body or whatever, but it's still highly effective if you approach it in the right way. So I'm not feeling any gloom from you pointing out the fact that that the mortality rate remains 100% doesn't surprise me, and probably not my audience either. So you moved into a place where now you had mentioned in your clinic, you're able to take care of your employees. That sounds like in a way that you were struggling to find that level of support and care in the previous place, so that you're making a place for people to thrive. Is that an accurate summary, or am I overreading what you'd said before?
No, that's correct. Yeah, I'm very um, cognizant about how the people that work with us are feeling and how they're functioning, because really the way that they function, it will have a direct outcome to patients' outcomes. So if we're functioning well, then patients can read and feel that and absorb that. And I think that's important, especially in the mental health clinic. And I just think there needs to be a different approach for mental health. It's not like every other business. I know that people like to put the business models into the ketamine clinics, but I think that's the wrong approach. So I'm approaching it in a different way, and it seems to be working so far. It is, however, a slower approach than just getting a bunch of money and just opening up clinics without really caring and being thoughtful about how you create it. And being thoughtful about how you create it has a lot to do with the people that work there. That I would say is the most important component. It's the human component. That's what's needed, in my opinion.
Yeah, that's a beautiful fact to acknowledge. When I was in physician assistant school in the military, I always joked around with my classmates that every rotation was a psychiatry rotation if you're paying attention. So we'd be in the ER, and sure enough, like, you're just taking care of everybody. Has a mind, so everybody has mental health, or everybody has, a soul, so they need psychological help, or however you want to parse that out, to recognize that everybody around you needs a certain amount of care in order to flourish, from the top to the bottom or from the center out, however you think of those things. I think it's excellent that you recognize that, and that you're building systems that acknowledge those facts of our reality. I asked the first question about what's your story, and we've kind of already started to transition a little bit towards the second question, which is about what are your intentions. The story looking back at your past, the intentions looking forward at what you're doing in the future. You'd mentioned a particular way that you're doing business in your ketamine clinics. Would you be willing to expand on how you intend to carry that forward?
Um, yeah, so I think the idea with these clinics is that you are forming a very close relationship between yourself and the patient. And the patient is also creating a very close bond with the person that's placing their IV, the person that's setting their intention, the person that's doing their psychotherapy session. And I think with ketamine and other psychedelics, it's important to really, really appreciate the fact that people really need to feel safe in order for them to be able to let go to a level where they could do some work. And I believe that part of that, the people that interact with you, is what will make you comfortable or not comfortable. So my idea is, first off, is just to get a great group of people to work together that are all there for the same goal, and that is mental health. You're not just there because it's a job and pays the bills, but you're there because you're actually really interested in this area. So whenever I hire people, I always make sure that this is something that they're interested in, not just like a job to make money. um, but yeah, I think thoughtful growth is the best way forward. I do occasionally have thought about franchising, because I think that's one way to create that. Because whoever the franchisee, or I guess the other person who is opening up another Propel, they'd want to be really invested in it the way that we are. I mean, they're gonna want to be wanting to care of people. and they need to be creating a team. And so when they're vested like that, I think it makes it a little bit more thoughtful instead of just like somebody like me telling all the different clinics how to do their job. I think it's best to, have that individual with every clinic. So that's how I see this thing growing. I am currently am working on franchising it, so that's kind of what I'm thinking forward.
So you're setting an intention around making shared intentions with all of the folks, from your patients to your collaborators to your employees, and then just franchising those shared intentions towards the flourishing of everybody that walks through the door is what it sounds like to me.
Well, yeah, I think what we're creating is a very good protocol and a very good system about how to best give this therapy. Also, but in an efficient way where, you can help a lot of people, because let's just face it, I don't think you and I have 5 hours in one day to spend on, going to a doctor's office or going to a clinic, right? 5 hours of your day, that's kind of a lot. So, you have to find that happy balance where it's just enough time, but not too much and not too little. And, that could vary from person to person. And I think this is why the program and the system that we have created really works well in order to address all those individual needs. And I think it would be a valuable thing to kind of spread out. So, yeah. So first step one is just to continue to refine what we have and then copy and paste, I guess.
Yeah, you're coming up with sort of your own unique protocols for different indications around mental health versus chronic pain, or some of those things around different dosing and duration of infusions and all of that. Is that what you're talking about, or am I misunderstanding and you're intending
No,
something
yeah,
else?
it's that. It's that. And then also the other components of the program, other integration groups, other support, other things that also come with that. But yes.
Yeah, start at least with, I nerd out about the medicine with my friends all the time, but we don't necessarily have to go on some kind of deep dive here talking about any of that. But yeah, it sounds like you're also talking about holistic protocols, like taking care of the whole person and the whole clinic, and meeting them in their whole lives. That's beautiful.
Well,
So
yeah. I mean, psychedelics are like that. They're not just like, here's a blood pressure pill or here's a Prozac. No, it's not. It's very different. And I think that's why I was telling you earlier, people try to apply the old business models to Prozac, to ketamine, and to psychedelics. And I just don't think they're going to be surprised. Let's just say that. And I think they already are, because there have been a couple of chains of clinics that have closed down recently because they were not doing well.
yeah, it's an interesting time to watch the the market interaction with the medicine and trying to figure out what the best way to meet everyone's needs in America is around providing these therapies. So man, those are beautiful intentions. Do you have any other intentions that you'd want to talk about?
Um, I don't like professional ones, or
It's my podcast. It's your episode. You can talk about anything you want.
Well, I just had a baby, so I guess my other intention.
Oh, congratulations! That's awesome. How long ago?
3.5 months.
Oh my goodness! Still a houseplant, water and light, and
Yeah, he's still a little guy.
Congratulations!
Yeah,
That's
thank
amazing.
you.
Is that your first?
Yeah.
Oh my goodness, you're amazing.
Yeah.
That's awesome.
Yeah, might be my last two because I was a geriatric mother. Do you know what that
Oh
is?
yeah. That always makes me laugh whenever somebody says that. That's,
Geriatric
as
pregnancy.
young as you are, but yeah, technically, sure. By the book, you're a geriatric mom, right?
Clean out the cobwebs.
Oh, that's awesome. So you got a little guy. Oh, sweet.
So I guess my other intention is just to, kind of bring up this young human so that he, I don't know, fits in, is normal, but, can think critically and, is just a good human. So, yeah, that's my other intention, I guess, on a personal level.
Yeah, well, thank you for sharing about that. I won't go down a rabbit trail around any of like the parenthood sorts of things, but like it's my opinion that we should pass some kind of legislation where like if you see someone with a young child, you should either be required to give them $1 or just ask them if they need help with something, or if you can't do either of those things, just leave them alone and get out of the way. It's just such an important neurodevelopmentally vulnerable time for everybody in the whole family system. And as a society, we need to like start coming around people in the chapter of life that you're in a much better way than we are currently. The answers there are way above my pay grade, but the work that you're doing there, that's the most important stuff on the planet. I love psychedelic assisted psychotherapy, but I mean, being a parent, God,
Yeah.
it's a mystery.
It's kind of fun though. I'm taking it in strides. It's kind of fun. I have to say, it's like you get to train this little human, and however
Yeah.
well you train him, it come at the end we'll all know, you know.
Yeah, it's
So
kind of
that's
like,
kind of the fun part. You don't see the result until the end.
yeah, it's like the arrow's launched, but you can still kind of adjust slightly the trajectory
Yeah.
now, right? And nudge it to the left and the right a little bit, but it's already
Right.
launched, right? It's out of the bow. It's his own little person now. Oh, that's amazing. I'm
Exactly.
glad I'm glad you're having fun with it too. That's a beautiful
Yeah, it
thing.
was. Yeah, I mean, I got a lot of everyone always tells you their terror stories, right? So it's been nice to kind of just roll with the punches a little bit. I think we're doing well. We're getting
Yeah.
enough sleep. Guys sleeping through the night. I mean, what else can you ask
Yeah.
for?
Well, yeah, what can you ask for if you're getting to sleep that soon?
Yeah.
That's a dream come
What
true. Yeah. So
Cool.
again, you've kind of anticipated the next question to some degree. You're very good at this. My next, question 3 is, what are you grateful for? Are there other things beyond the little dude that you're grateful for?
Oh gosh, of course. There's lots of things I'm grateful for. I mean, I'm grateful that I was brave enough to take this little leap of faith and create something that I really enjoy growing and going to work at. And I'm really grateful for my parents because they're very supportive and they help with other aspects of our lives, like take care of the little man occasionally, or always lots of advice from them. So, and then I'm also grateful for my significant other because he's been really um, I mean, he's been really, really supportive and very encouraging. So, with any business, there's always ups and downs. I call them the waves of the ocean. And, when you're on the trough of the wave, it can get a bit disparaging. And then you start having these intrusive thoughts like, okay, am I doing the right thing? Should I have just go back to the hospital? But yeah, I think him being there and always being positive about everything, I think it helps me like move past those periods, and then we're all good again. So it's yeah.
So, with your whole story and all of the intentions that you've set and the gratefulness that you're carrying, what are you creating?
Well, I think I'm creating what everybody else is trying to create, which is to have a life that they enjoy and to hopefully live every day to the fullest and try new things and explore new areas. And yeah, so I think that's my final answer.
Accepted. You're a winner. So that brings us around to the last question, which is sort of an identity question. Who are you really, Dr. Sofia Peeva?
Let me go back to philosophy 101. I'll tell you a funny story about my philosophy class. So, okay, so first of all, I want to preface this with like, most doctors and people in the medical field, and correct me if I'm wrong, most of us are like type A, and we're very like, by the book. We have our lists. We're like accomplishers. We're very astute. So going back to the psychology class. So what happened with me is I thought I graduated from college and I had my parents there and I walked through the stage. And then a few months later, I went back to pick up my diploma. And at the diploma office, the lady told me, like, oh, no, it looks like you never graduated because you forgot to take this one requirement. And this one requirement was a philosophy class. So my parents, like everyone thought I had graduated. I had gotten a job with my new credentials.
Now you're having an existential crisis over a philosophy class.
And now how am I going to tell my parents that I didn't actually graduate? Like, this is going to be the most embarrassing thing. So what I do is I go behind their back and I find some community class that would, I could translate over to my college so they would give me my diploma. So I'm doing this online, I'm doing this philosophy class, and these are the kind of questions that they were hitting me with, who are you really? And every time I think of, so when I read this question, that's what it took me back to, the time when I didn't graduate from college, but I walked on the stage and took a diploma from the dean.
You were like a poser. You hadn't checked the philosophy block, but you wore that cap and gown and walked across the stage. It's funny,
Right.
like I did the exact same thing, but it was an art class. The exact same thing happened to me, and I had to go back and take 3 credits of art to get my first bachelor's degree. That's crazy.
I feel like if I had never gone back to get my diploma, I would have probably thought I had graduated, and eventually, of course, when I applied to medical school, they would have been like, I think there's a problem here. But
so you took the philosophy class and you passed, so now you know who you really are, or
who am I really? I don't. That's a very very broad question, really. I think I'm somebody who cares a lot, but is also not afraid to take care of business and do what has to be done in order to move forward or to survive, if you will. Also, I think I'm somebody who has gotten so many rejections throughout my life that I really roll through rejections and I keep moving forward. So I think that is also very helpful. Because, that's how we learn. We learn from our mistakes, and that's how we grow. So if you're never making mistakes, are you really growing as a human, as a person? So yeah, I think that's a wrap for me on who I am.
Yeah, you're clearly a very strong person. Do you have any final thoughts for our audience?
Well, final thoughts. Always put value on the things that improve your quality of life. That's it. Those are my thoughts.
Final answer.
Yeah.
That's great. All right. Well, I appreciate having you on the podcast.
Thank you so much for the invite. It was really fun to spend some time with you today.
Yeah, this was a great time. Doc out.